fact, I'd like to incorporate them by reference in my comments because they were so on the point on the issue of substance as to what this bill does not do and what it does do. And in both instances, he's absolutely right. The bill does not accomplish what we set out to do, which was cover all Americans, which was bend the health care costs down, which was to let you keep your insurance if you had it and not have your premiums go up. It does just the opposite. It's a $2.3 trillion increase in health care spending. $2.3 trillion. That's how much it grows the government. Health care costs go up by over $230 billion in the first 10 years. We know premiums are going up. And now we have this interesting issue involving Medicare. We've heard a lot of talk from the other side of the aisle about how Medicare is not being cut, and if it is being cut, it's just being used to help a new entitlement, and therefore it should be counted as part of the basic effort to bring fiscal responsibility to this bill. Well, that's hokum, just pure unadulterated hokum. Medicare is being cut by $500 billion over the first 10 years, $1 trillion over the next 10 years, the first 10 years of full implementation, $3 trillion over the first 20 years. And then the money's being spent, not to make Medicare more solvent, not to make Medicare stronger so it doesn't have a huge unfunded liability. It's being spent to create this brand new entitlement, an entitlement which is massively going to expand the size of government by $2.3 trillion. The American people understand this doesn't work. Common sense kicks in with the American people. They know from common sense that you can't possibly cut Medicare by $3 trillion, spend it on a new entitlement, and have fiscal responsibility around here and claim that Medicare is better off for it. And they don't have to know it through common sense. All they have to do now is listen to the CBO, which has now written us a letter. Let me quote from this letter because it's a devastating letter. I just wish this bill were going to be on the floor long enough for it to actually be open to public view and have some sunshine on it. It's being rushed through here just before Christmas so nobody can see what's actually in it. But here's what CBO says. The key point is that the savings to the HI Trust Fund, that's the Medicare Trust Fund, under the bill, they use the acronym for it, would be received by the government only once. So they cannot be set aside to pay for future Medicare spending and at the same time pay for current spending on other parts of the legislation or on other programs. Exactly what this bill does. It spends the Medicare money on other programs. They go on to say, and this is CBO speaking, not me, to describe the full amount of the Medicare Trust Fund, again they use HI Trust Fund, savings as both providing the government's ability to pay for future Medicare benefits and financing new spending outside of Medicare would essentially double count. I repeat, double count a large share of those savings and thus overstate the improvement in the government's fiscal position. The simple fact is that what's happening here is a scam. Pure and simple scam on the American people and especially on the seniors in this country. Because Medicare is being cut by billions of dollars in order to create a new entitlement, and it's going to have a massively negative effect on the fiscal health of this nation. Because we know that new entitlement won't be fully funded. And we know that Medicare has $35 trillion of unfunded liability out there. And if you're going to cut Medicare by $3 trillion, as the other side of the aisle is proposing, if you're going to eliminate Medicare Advantage for a large number of seniors, except those who live in southern Florida, then that money ought to be used to reduce the debt so that the Medicare system becomes more solvent. It's that simple in the long run. It's not being done here. CBO has pulled the curtain back from this game and made it very clear it's not going to be done. Of course, nobody's going to learn this because they're going to pass this bill through here before anybody can figure that out and even listen to CBO. You know, it's just an outrage the way this bill was put together. We all know that. Dark at night, back rooms, deals everywhere. Only a few people in the room, those people that really drafted the bill, very small crowd. Nobody else was allowed in, no cameras, no information about what was going on. And then you'd bring in a senator here and a senator there and say, what do you need for me to vote, to get your vote? And something would appear in the bill, I guess. And then the bill arrived here. Now, it's not unusual around here to have earmarks in bills. If they're within the budget, and the budget's reasonable, I've even asked for earmarks. But this goes way beyond the concept of earmarks, this bill. This bill fundamentally changes policy. That's never happened around here for one part of the country as versus another part of the country. In other words, all of America, all American seniors will have to live by massive cuts in Medicare Advantage. That's a pretty good health insurance program for a lot of seniors. I think there are 11 million seniors on that program. All of America has to live by that policy, except for 3 counties in southern Florida. All of America has to live by an insurance situation where insurance companies are taxed at a certain rate, except insurance companies in Nebraska. All of America has to live by Medicaid reimbursement rates, which are going to cost the states billions of dollars. New Hampshire, $120 million over 10 years, except for Vermont and Massachusetts. And then there's a special exemption in here for New York and a couple of other states. Louisiana, $300 million. That's a total corruption of the concept of policy. Policy in America is supposed to cover everyone. When the federal government acts, it's supposed to be a policy that affects everyone equally. You're not supposed to have little cadres of exceptions for those policies. You know, this bill's been called historic by my colleagues on the other side of the aisle. Well, you know, the most historic thing about this bill is the fundamental damage it has done to the concept of open, thorough, and public debate that was at the heart of the thought process of Adams and Madison, our founding fathers, when they created the checks and balance system with the Senate at the center. The Senate was supposed to be the place where bills come to the floor, they're open to debate, there's amendments, and you have a process where things get aired and there's sunshine. No sunshine here. No, not at all. This is not majority rule as conceived by our founding fathers in Philadelphia. This is closer to the single-party state system that we see in Europe, or have seen in Europe. The minority is ignored, and there are no checks in this process on the autocratic rule of the majority. And the irony, of course, is that the bill never went through the public's consideration, never went through committee, and was drafted behind closed doors, and has been on the floor for less than 72 hours. As a result, we're delivered a health care bill that's been corrupted by special interests, especially on the issue of policy, that is extraordinarily expensive, and has a massive expansion in the federal bureaucracy, to which, if you applied the word reform, you would have to call Bernie Madoff honest. The terms just simply don't apply here. Unfortunately, this bill in its present form, I believe, will lead to fundamental harm to the fiscal health of this nation. There is no question in my mind but that if we load another $2.3 trillion of cost onto our government, expand our government in this manner, that our children are going to be past a nation where they have less opportunity than our generation had. And further, I don't think it's going to help the nation's people relative to their health care. I think it will lead to a significant contraction of the quality of health care, especially for seniors, but for all Americans, as we lose the innovation, the energy for innovation, and the resources for innovation. And as a result, this bill, in my opinion, should be sent back to the drawing boards and should be reconsidered. Mr. President, I yield the floor.
Mr. President.
Senator from Texas.
Mr. President, over the last few days, we've learned